color. They're even, pinkish undertones. You see, the very tiny veins. Okay. You also assess for the temperature again. So the toes really are cooler to touch compared to the upper area of the legs. And then you have the presence of superficial veins, very superficial, no varicose veins, just very superficial veins. You'll see that there's hair, small fine hair growing, okay, and so that means there's good circulation, okay. No lesions, skin is intact, right? And then we now assess for edema over by the shin bone or the tibia. Okay, there is the elasticity of the skin. Okay, now over by that area behind the medial malleolus, apply pressure for about 5-10 seconds. Okay, and then dorsum of the foot. So now we do our, don't forget, you need to do also your capillary refill for the toes. Okay. What's good with princess toes, you'll see that there's hair growing near the big toe. So that means,
today, guys.
that means there is good arterial flow here. Okay. Now, we do our palpation of the lymph node, inguinal, just point to where it is. You also have the femoral pulse. Okay. For the popliteal, because your patient is lying down, can you please bend your knee? Okay. It's more, okay. You will feel here the tendon. There's a tendon, okay, at the back. Okay. Feel not on the tendon itself, but beside it. And you have to really push your finger because it's a very deep artery. So the pulse is going to be really deep. So you have to like push your finger. Okay. Good. It's not as, it's there, but it's not, as strong as. But they're bilaterally equal. Okay, good. And now we do our assessment of the dorsalis pedis pulse. So like I said, you'll have a lot of, if you do it here, there's a lot of tendons in this area, tendons and ligaments. So in this area, between this area here, there's a very small area that's covered by skin. So that's where you feel it, and you have to put your fingers very lightly. Otherwise, you'll push the artery underneath this tendon. Good. Okay, so the dorsalis pedis and posterior. Stronger here. Okay, posterior tibial. All right, so the pulses are bilaterally equal and strong. And then we assess our arterial insufficiency. So, Princess, do you mind raising your leg? And then flap it. Okay, for about a minute.
Okay. You're gonna get tired of holding my leg.
Nah, no one is going to get tired. Okay, for a minute.
Hello, people.
You'll see how the foot is starting to turn very pale.
Pale, yeah.
Mm-hmm. And then she will dangle it here so that you'll be able to see.
God, it's like white.
Uh-huh. Are you tired yet?
No, but I can't feel my leg anymore.
Okay. All right. So just dangle the foot. Observe it. Okay. You see the quick return of the color?
Oh yeah.
You feel it too,
Yeah,
right?
I do.
Okay, so that means
It gets warmer, right?
there is
It gets warmer.
Yes, I get one.
that means there is good arterial flow to the extremity. Okay, that's why I said we have to test both extremities. Okay, of course you cannot just do the right or either the left, but in in some instances they do both at the same time. I go, that's very difficult to do. So you do it one at a time. Okay, and then we do our test for incompetency of the valves. Okay, so we pretend she does not have any varicose veins, but let's pretend that there is a varicose vein that stretches that way. Okay, so distally, I will apply pressure. Okay, for about 15-20 seconds. Okay, and then 5 to 8 inches from this area that where I applied pressure, feel for a pulse. Okay, if there is a pulse, that means the vein is incompetent. If there is none, that means the veins are good. Okay, and then the last part will be to auscultate the arteries. You? Okay. Now, to auscultate the arteries, okay, we'll need to Okay, so again we make use of our okay, so this is the mid-epigastric area. A little towards the left is where you will listen to the aortic bruit, if present. You have the right and left upper quadrants. What arteries are here?
Stomach one?
No. Huh?
The big one.
Renal. Renal first. And then right and left lower quadrants. Iliac. And then the right and left femoral arteries. Okay, so just to listen.
There's a trill.
This is where. Okay, so these are the different skills for the heart and peripheral vessels. Questions? Okay, thank you very much, Princess. Now, you do your skills until 12 to 30 or so, and after which you can use a dummy to practice on the
Leads.
leads, the application of the electrodes. Okay, so that you can also try clipping the cable. Okay?